Pregnancy is an amazing journey, but for some, it comes with a unique challenge: managing blood sugar. Whether you had diabetes before getting pregnant or developed gestational diabetes along the way, keeping your glucose levels in check is one of the most important things you can do for yourself and your baby. Today, we're going to dive deep into why this is so critical, what the risks are, and most importantly, what you can do to have a healthy, safe pregnancy. So, why does blood sugar become such a big deal during pregnancy? It all comes down to hormones. Your body goes through massive hormonal changes to support your growing baby, and these shifts can interfere with how your body uses insulin. This can lead to high blood sugar or hyperglycemia. For some women, this is the first time they've ever had to think about blood sugar, leading to a diagnosis of gestational diabetes. For others who already have type 1 or type 2 diabetes, pregnancy can make managing it much trickier. Let's talk about the risks, not to scare you, but to empower you with knowledge. High blood sugar, especially early on, can be a serious concern. Research shows it's linked to a higher risk of miscarriage and can affect the baby's development. Excess glucose can cross the placenta and interfere with the formation of the baby's heart, central nervous system, and kidneys. As the pregnancy progresses, uncontrolled high blood sugar can cause the baby to grow much larger than average, a condition called fetal macrosomia. While a chubby baby might sound cute, it can lead to a difficult delivery, birth injuries like shoulder dystocia, and a higher chance of needing a C-section. For you, the mom, the risks include developing preeclampsia, a dangerous condition with high blood pressure that can threaten both your life and your baby's. There's another key issue after birth. Babies who are exposed to high glucose levels in the womb produce extra insulin to handle it. Once they're born and that sugar supply from you is suddenly cut off, their high insulin levels can cause their own blood sugar to drop dangerously low. This is called neonatal hypoglycemia, and it can lead to other complications like jaundice and breathing difficulties, often requiring immediate medical attention in the NICU. And the concerns don't just end at delivery. Women who have gestational diabetes are at a much higher risk of developing type 2 diabetes later in life. It's like a warning sign from your body that you need to pay close attention to your health in the years to come. So, what's the game plan? The good news is, with the right care, you can manage these risks effectively. This isn't something you should ever try to handle on your own. The first and most important step is to work closely with your healthcare team. This usually means your obstetrician will partner with an endocrinologist or your primary care doctor to create a comprehensive plan. They'll monitor you closely, using tools like regular blood glucose checks at home and hemoglobin A1C tests, which give a bigger picture of your blood sugar control over several weeks. Now let's talk about one of the most powerful tools you have: nutrition. This is where a registered dietitian becomes your best friend. They can create a personalized eating plan that meets the nutritional needs of your growing baby without sending your blood sugar on a roller coaster. The goal isn't to be super restrictive or to cut out carbs completely. Instead, it's about balance. A good plan will likely involve spreading your meals and snacks evenly throughout the day to keep your energy and glucose levels stable. You'll focus on complex carbohydrates that are rich in fiber. Think whole grains, beans, and vegetables, instead of simple sugars found in candy, soda, and highly processed foods. You'll also need plenty of lean protein and healthy fats to keep you full and support your baby's development. Consistency is key, so sticking to a regular meal schedule can make a huge difference. Remember, this is all about creating a balanced, safe plan guided by a professional. Next up is something that's often overlooked but is absolutely vital: hydration. When you're pregnant, your body needs more water than ever. It's crucial for making extra blood, forming amniotic fluid, and delivering nutrients to your baby. Staying well hydrated also helps your body regulate blood sugar, and can even reduce the risk of urinary tract infections, which are more common during pregnancy. How much should you drink? Your doctor can give you a personalized recommendation, but a good rule of thumb is to sip water consistently throughout the day, and try to make plain water your go-to drink. avoiding sugary juices and sodas that can spike your glucose. Physical activity is another important piece of the puzzle. Gentle to moderate exercise, like a daily walk or a prenatal fitness class, can work wonders for improving your body's sensitivity to insulin. It's a natural way to help manage your blood sugar levels. Of course, you should always talk to your doctor before starting any new exercise routine. They can help you figure out what's safe and appropriate for you based on your health and stage of pregnancy. Sometimes, even with the best diet and exercise plan, blood sugar levels can still be too high. In these cases, your doctor might recommend medication, most commonly insulin. If you hear the word insulin, don't panic. Insulin is considered very safe for use during pregnancy because it doesn't cross the placenta, so it won't affect your baby. It's simply a tool to help keep your body in balance. It is absolutely critical that you only take insulin or any other medication under the direct supervision of your physician. Never try to self-medicate or take supplements without their approval. Putting it all together, a healthy pregnancy with high blood sugar is all about a comprehensive approach. It's about attending all your prenatal appointments, doing your lab tests, monitoring your blood glucose as directed, and being an active partner in your own care. Simple things like getting enough sleep and managing stress can also have a surprisingly big impact on your blood sugar levels. Think of it this way: managing your blood sugar during pregnancy isn't just about getting through the next 9 months. It's a long-term investment in your health and the future health of your child. By taking these steps, you're not just reducing the immediate risks. You're setting a foundation for a healthier life for both of you. If you're pregnant and dealing with high blood sugar, prediabetes, or diabetes, please don't ignore it or feel like you're alone. The risks are real, but so are the solutions. Reach out to your healthcare providers, follow their guidance, and embrace the team approach. With the right support system and a proactive mindset, you can navigate this challenge and look forward to welcoming a healthy, happy baby. Thanks for watching today. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and subscribe to our channel for more content to support you on your health journey. Stay safe, stay healthy, and we'll see you in the next video.